Thank you for your interest in this poster presentation. I'm going to present the poster in a PowerPoint format. So, Fahr's disease, a patient perspective of presentation and clinical expectations. And this was undertaken by myself and Dr. Amit Batla. Myself being Adam Tate, founder of Far Beyond, and Dr. Batla, a honorary consultant at Queen's Square, the National Hospital for Neurology and Neurosurgery. So, Fahr's disease is a difficult disease to try and find a specific definition of what it is. So we present Fahr's disease, also known as primary familial brain calcification, among other definitions, but we present it as being a neurodegenerative disease, which involves idiopathic basal ganglia calcification without a secondary non-genetic cause. So picking up very much on Time Batla's definition, Fahr syndrome being a much broader term to encapsulate brain calcification or basal ganglia calcification, often involved in the cerebellum. Whilst there have been quite a lot of advances in identifying genes associated with Fahr's disease, so most common one being the SCL20A2, and more recently there's been the MYORG gene identified, and there's some forthcoming research which will be identifying some further genes. So roughly 5 to 10-ish genes, depending upon the literature and the robustness of that literature that one is to follow. Very often Fahr's presents with neurological symptoms such as movement disorders, gait balance issue, seizures, headaches, and TIA-like episodes, dysphagia, dysarthria. Patients won't necessarily present with all of those. Indeed, many patients might be asymptomatic. Psychiatric symptoms as well might include depression, anxiety, psychosis. In some cases, schizophrenia as well has been reported. A cognitive, such as intellectual disabilities, which might include autism, it might include the likes of dyspraxia and dysgraphia, dyslexia, dyscalculia, mild cognitive impairment, and dementia or Alzheimer type presentation. So what did we want to do with this study? The study was a single method cross-sectional piece of research, reaching out to as many people within the Fahr's community as possible. So this was something that there was no, at the time, there was no home for people with Fahr's disease per se in terms of a clinical home. There was no dedicated service at the time in the UK or indeed anywhere globally. So what we wanted to do with this survey was to understand how Fahr's patients, A, were diagnosed, B, who diagnosed them, and what were the methods used for diagnosis. So to give us a bit of a picture about how people were coming to a determination of Fahr's. To gain greater clarity about the symptoms of people living with Fahr's disease. So here, talking more about anecdotally reported than necessarily attributed by a clinician, although we were interested in both. To gain an insight into how Fahr's patients' symptoms are currently managed, to establish whether patients believe there should be a specific national referral service for people with Fahr's in the UK, and then to better understand some of the expectations of people with Fahr's disease of that service or clinic per se, and more broadly some of the clinical standards. So who should diagnose Fahr's? How often should those patients be seen, ideally? What advice might be available? So both clinically and importantly for us as a charity supporting people with Fahr's. And then what patients might expect in terms of the management of their symptoms. And this would also help us in setting expectations for patients and for clinicians. So data was collected through the use of an online questionnaire to reach as many people as possible. The questionnaire was disseminated through 2 patient Facebook groups that have probably the largest international audience for Fahr's disease, also reaching out to people via email that had contacted the charity previously. So this research, I have to stress, follows far beyond research framework and our expectations of conducting research, which is in line with the Charity Commission's guidelines. Also, those conducting involved in this research are experienced researchers and have gone through due ethical processes. And for us as a charity, fairly small charity, ensuring that this was robust research really ensured that the ethics was right, that this was very clear to patients what this research was about, the scope of it, what it was for, ensuring that people had the right to withdraw, such as on page 1 of the questionnaire of the 9 pages, right to withdraw was highlighted there along with the use of data, and then also again a reminder on page 9 that participants had that right to withdraw, and indeed they had to tick a box to say that they understood. So a questionnaire was structured along some key themes there. So what the symptoms were, the diagnosis process, the treatment or the management of Fahr's, because we know that there's no cure for Fahr's, but kind of the management of symptoms, and then expectation of services at a Fahr's clinic or a Fahr's referral service. So it was conducted through JISC online surveys in 2021 through to October 2021. So participants self-selecting and then data analyzed for key themes. So with the findings, I think it's important to highlight here that there were 20 eligible people who participated in the survey. Consisting, I'll just go back a page, consisting of open questions and closed questions. So you can see that in total there were 18 actual targeted questions, and the open questions were there to provide some rich insights. Okay, so 20 eligible people, 2 of whom withdrew, 10 people were filtered out, and there were 288 unique landings onto the survey itself. So it attracted a lot of attention, and indeed, there was a lot of feedback from people who internationally wanted to participate, but because this had a focus on a UK service, the eligibility criteria was for somebody with or supporting someone with Fahr's disease, and they had to be a UK resident. So whilst the sample size was a limitation, it was also the largest patient survey of the Fahr's community undertaken to date, and the largest single collection to date of clinical presentation of data, although working forwards that hopefully new research, new findings with Queen Square will help demystify and provide further data. So I think overwhelmingly to highlight here is that all respondents believe a need for a dedicated Fahr's clinical service in the UK. We can see here that there are a range of symptoms reported, and two people indeed said that they were asymptomatic, whereas we've got some of the most reported, with 8 of the participants saying that they had movement issues or a form of movement disorder. And then interestingly, the second most reported symptom was memory issues. So this provides some interesting insights for taking further and so thinking about the diagnosis, 94% of the participants said that they had a CT or an MRI scan to establish their diagnosis, which would say is in keeping with good practice. However, who diagnosed, as in the clinician delivering the diagnosis of Fahr's, seems to be slightly more broad than maybe expected. So we can see indeed a range here from a stroke doctor, radiologist, geneticist, etc. Can see in figure 4 there. Whereas respondents felt that by and large it should be a neurologist with Fahr's expertise who should be providing a diagnosis of Fahr's. So figure 5 here shows that the participants recorded a whole range of different medications that is being used to manage their condition. And we can see that of those who responded, 10 have some form of medication for management. So 62% taking medication there. So the responses of how patients' Fahr's is currently managed tends to be through medication. We can then see that no management in the cases of 4 respondents, and neurology follow-ups. If we were to combine the 6-monthly and the 12-monthly, therefore that would be the second most frequent method of management, is that ongoing visit for monitoring of the disease. Then what was really useful for figure 6 here was the range of different forms of advice that patients felt that was needed. So living with Fahr's disease being one of the larger reported or desired aspects of providing advice, then providing advice to non-specialist medical clinicians, such as GPs, so onward referring. And Fahr's and medications and the kind of how to assess Fahr's as well came out, not unsurprisingly, as aspects where there's not a lot of accessible information is one of the desired things that Fahr's patients do indeed want. So they showed an expectation as well in terms of, and this might be where expectations have to be managed, of being seen within 3 months. So 50% felt they should be seen within 3 months of a referral being made to a specialist clinic. 83% felt that they should be seen within 12 months. So that's quite a high potential expectation, and it would need to be clear in some of the messaging of how frequently and how and the time for accessing that initial assessment at a national referral service. Similarly, 72% felt they should be seen every 6 months or more frequent. Again, that's something to bear in mind for the resourcing of a clinic. So many participants did express a sense of needing support and direction about their condition, a sense of how's it going to progress? Will it get worse? What's the impact upon my family? What will I do as I get towards the end of my life? Actually, how long do I have left to live? Whilst the medical evidence might not necessarily be clear on this, these are some of the questions that could be posed, and something for us to think about as a charity as well, about the information that we prepare and can support a national referral service with disseminating. So it's shown that this survey's shown that there's an overwhelming need for a dedicated national Fahr's referral service. And from the participant data, it's clear to see that often patients have a range of features to no clinical features, and there's no universal approach to diagnosis nor management of Fahr's. So this provides us with an interesting point for moving forward, to think around a national framework for diagnosing and managing Fahr's, and indeed that those recommendations being taken forwards in our advocacy work for some nice guidance on Fahr's. So from the participant data, it's clear that there's complex features, that Fahr's patients, there's no one approach. So gathering expertise around how to best work with that patient, both at the national service and locally, would be very useful. And I think it's important here to highlight as well that our findings are not unique to Fahr's disease. Indeed, many of these are what appear as key priorities on the UK's rare disease framework. So with that, just a thank you for your time and your interest in this poster, in this presentation. If you would like to find more out about Fahr Beyond, please visit farbeyond.org. You will also find on our website some key recommendations from our clinicians, and indeed led by Dr. Batla, some key recommendations in the diagnosing and management of Fahr's disease, and that can be found on our medical professionals tab. So thank you.